Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Today we're announcing 12 new cases of COVID-19, bringing our total to 194. The total number of deaths related to COVID-19 remains at 2. As of this morning, 10 individuals are hospitalized, with 6 in intensive care. We are reporting 17 individuals listed as recovered. Public health investigations continue to confirm details, and information will be updated on our website as information becomes available. Yesterday, 567 tests were completed at Chatham Provincial Lab, bringing the total completed tests to 12,514. I can confirm that testing has been completed on the residents of Bedell Home and Gimli. No residents have tested positive for COVID-19. As the pandemic continues, we continue to ask Manitobans to take significant precautions. We know that these precautions can present a challenge, but we're also aware of the significant risk this virus can pose to Manitoba. So the social distancing messages remain and continue to remain and should be everyone's focus. Stay home whenever you can. It's your best way to protect yourself, people around you, and our community in general, including our healthcare providers. This messaging also applies to holiday dinners. There are many planned holidays coming up, and it's the norm for many Manitobans to get together, sometimes in large family gatherings. Now, unfortunately, is not the time for that. The time remains to be staying at home. If possible, stay connected through virtual means, but now is not the time for family gatherings. We know that in many jurisdictions there has been transmission of virus in these settings. So please stay connected. Please reach out, especially to vulnerable Manitobans, but now is the time to stay home. Do not plan large family gatherings where we know this virus has been transmitted in the past. We know that we have seen evidence of community-based transmission. So these social distancing strategies, keeping 2 meters apart from everyone at all times, if you must go out, need to be adhered to wherever you are in Manitoba. Do not just start implementing these ideas when you think you've heard of cases near you. Now is the time for action. Now is the time to stay home, connect virtually to friends and families. If you must go out, please adhere to social distancing strategies at all times. Wash your hands frequently. Absolutely stay home if you're sick. If you need healthcare advice, stay connected with your healthcare provider. Call HealthLinks if you have questions. But if you're sick, stay home. We're continuing to remind Manitobans to search for credible information, and our website, manitoba.ca/COVID-19, is an up-to-date source of credible information. I encourage all Manitobans to stay up to date as the situation unfolds. We have put a lot of measures in place. Public health orders are in place, and these are all because we are not helpless against this virus. We have roles that all Manitobans can play, starting today, to reduce the impact of this virus. Stay home, practice social distancing, and we will interrupt the transmission of this virus, and we'll start seeing that curve flatten in Manitoba. And so thank you, and I'll pass it to Lanette.
Thank you. Good afternoon. So today we're going to start changing the things that we report, the health links, the negative lab reporting, and the screening sites. We'll now report on a weekly basis. And instead what we'll do is change to the evolving needs of this pandemic and make sure that we are, in the interest of transparency, providing the information that you need as planning progresses. So today I want to start by talking about healthcare workers. There's been a lot of understandable interest in how many healthcare workers in Manitoba have tested positive for COVID-19. And today I'm going to begin, and I'll keep on going, providing information as we receive it. So 14 of the 194 Manitobans who have tested positive for the virus do work in healthcare. Some of these tests are related to travel, and I can report that there are 0 healthcare workers who have COVID-19 in Northern Regional Health Authority, Southern Health Santé Sud, and Prairie Mountain Health at this time. There are also 12 healthcare workers who work in Winnipeg, and 2 who work in the Interlake Eastern Health Authority. The 2 in the Interlake Eastern does include the case at Selkirk Regional Health Centre, which was mentioned earlier this week, and also includes the case at Bettle Home Gimli, which is still being investigated as a presumptive positive. We will aim to update these numbers regularly as information continues to be available. And we do appreciate that this is of great interest to the media and the public. And we just want to emphasize that there will be occasions where information has not yet reached Brent or I when we come into this room every day. And it's important to understand that at the moment a positive case is identified in a healthcare setting, whether it's a patient or a healthcare worker, work begins right away to establish contact tracing, to provide clear direction to those who may have been in close contact with those positive cases, and to ensure that the environment is appropriately disinfected. Family notification and staff notifications are also completed as soon as possible. And the occupational and environmental safety and health, we call them OSH, and the infection prevention and control professionals are involved from the first moment a positive case is identified. This is a robust and comprehensive response. And understandably, the #1 focus in each healthcare environment, they're taking the appropriate steps as fast as they can. So this means that there will be times where rumor or word of mouth gets out publicly before Brent and I can get to a particular email and confirm that it's an actual case. But Manitobans can be reassured that the process is in place. It is swift, it is responsive, and it's working. So I also want to speak about personal protective equipment. So efforts to establish universal PPE continue with specific guidelines now on our website that are available for healthcare workers across all settings. These changes are being made as part of Manitoba's escalating response to COVID-19. That escalating response includes enhanced screening of staff within facilities prior to the start of their shift, and updated guidelines have also been established for municipal policing, emergency response services, as well as for shelters. It's important to note that the changes are being implemented at the earliest sign of community transmission to prevent further spread. Some sites have already implemented these changes, while others are ramping up. And changes of this nature do take time to implement. So we will continue to work with our supply chain to ensure orders are processed and delivered so that universal PPE is in place across all regions for healthcare professionals across the province by the end of April 13th. By the week of April 13th. The other thing that I wanted to touch on is return to work. So as discussed briefly yesterday, work has been underway to identify protocols for the safe return to work for some staff. For those who are asymptomatic and who were not in close contact to a patient or a colleague who were tested positive for COVID-19, staff may be permitted to return to work once their facility has implemented universal PPE. A risk assessment will be conducted in every instance by occupational health, and staff will be required to follow universal PPE protocols, practice social distancing, and self-monitor for symptoms. And the other thing to talk about is alternative isolation centers. So I've been speaking about that for the last week, but we are now moving to establish these isolation centers for those who may require some additional support as they self-isolate. So the first isolation center will begin to accept individuals this weekend. It will include healthcare workers and other Manitobans who have COVID-19 who may have been exposed or they need a dedicated required space to isolate from their families or their loved ones or their roommates. And these centers will adhere to public health guidelines, and guests will be required to self-isolate in their rooms at all times. Isolation centers will practice enhanced cleaning, disinfecting practices, and sanitizing all equipment used in food preparation multiple times per hour. As well, all social and physical distancing practices will be adhered to, and centers will practice zero contact services whenever possible. And more information will come in the coming days in terms of the intake process as we ramp that service up. N95s, like many of you have read or heard about the emerging research on the sterilization of N95 respirators. And as part of our ongoing efforts to ensure every possible contingency plan is in place to ensure a robust supply of PPE, housekeeping at all our acute sites will soon begin to collect gently used N95 respirators from all clinical areas. Soiled, wet, damp, and stained N95 masks will continue to be discarded. And finally, on a good note, we know Manitobans are generous by nature, and every day Brent and I, Dr. Roussin and I, receive stories about how people are rising to the challenge of COVID-19 and responding in the most wonderful of ways. And so I want to share with you today this story about Tommy Barr. So Tommy is a pharmacy manager at the Flin Flon General Hospital, and for months he and his mother Gwen have been planning a trip to Australia and New Zealand. And then COVID-19 happened. His trip was canceled, and although he was very disappointed in this, within days he found a way to turn this situation around and do something amazing for the community that he lives in. Tommy took the $5,000 that he had set aside for his trip and donated it to Lord's Bounty Food Bank. And Tommy's contribution accounts for nearly a sixth of the food bank's budget for the whole year. So we know that charities are struggling right now with donations due to COVID-19, and Tommy's contributions will allow his community's food bank to continue to help those in need during this challenging time. So I want to say thank you very much to Tommy, and thank you to all the Manitobans who are doing what they can to help the less fortunate right now. So with that, we can go on to questions.
All right, thank you very much. A reminder to the reporters on the line, please mute your line when you are waiting for the answer. And we'll have one question followed by one follow-up. We will start today with Josh from the Winnipeg Sun.
All right. Hi, this is Josh from the Winnipeg Sun. Just looking at the PPP, the universal PPE. I know one of the big concerns at some of the shelters is access to the PPE. Are they going to be given supplies to ensure that they do have, or that they can meet the universal standard?
Yes, that is our goal. So as I said, we put guidelines on our Shared Health website so that it provides some direction for different workers in different environments. So that includes policing and shelters. And we took that approach because we wanted to make sure that all workers were safe. It's not our normal approach, but obviously in the pandemic, we are required to think a little broader and bigger. So, and we will be making every effort to make sure that the supplies get to where they need based on those protocols. And it will take a bit of time, but I know work is underway this weekend. They're looking at shipping supplies. It will probably be a 2-week supply at a time, just to make sure that we are having a good control over the inventory and also managing with the supply disruptions that we heard about earlier this week. So there are challenges with procuring the PPE, but we are going to make every effort to make sure that all our workers have what they need.
All right. And Dr. Mitchell, this is more for you, I guess. As we look at entrance events here and people wanting to get together, churches are obviously not considered essential services, but there are a number of things that people are not about being essential services, things like liquor stores and cannabis stores. Is there going to be any changing of these types of services that are considered essential services going forward, or is what's going to be considered an essential service?
Well, just like our approach from since the beginning is we're always looking at what we need to do to improve things. So we've just implemented these orders as a few days ago, and so we'll need to assess the response to that. But moving forward, we'll look at whatever issues we need to deal with to further interrupt the spread if necessary.
Thank you, Josh. Now we move to CBC. Holly.
Hi there, Holly Carrick, CBC News. It's my understanding that the majority of Winnipeg hospitals use primarily the 3M masks. And given President Trump's order for 3M only to sell within the U.S., is there a plan maybe to switch to other vendors, or how are we handling that?
Yeah, absolutely. And that has been our strategy throughout the pandemic planning, is we are moving to the vendors that are available and have stock. So we are in communication with other vendors globally. We're also looking at other strategies where we can, as you know from Dr. Kumar's research about reprocessing the N95 masks that are gently used and can still be cleaned and reused and are safe. So we're looking at that option. There's also some work going on, really creative geniuses at work looking at 3D printing for N95 masks. So there's we're going from all angles trying to make sure that we maintain our supply.
Okay, and a second question isn't really related to the masks, but the isolation centers you were speaking about. Will those centers be secured, and how do you ensure that these people will be self-isolating?
Yeah, that's a great question. So we're starting off slow this weekend, and we will work through the process because we want people to arrive and be safe and have a clear pathway for them to get to their rooms and make sure that they have everything they need in terms of food and how they can call for help. And so make sure those processes are really streamlined and well thought out. And then starting early next week, we'll have more staff come in, and there is lots of thought gone into this plan. So there will be one area where COVID positive patients will be. There'll be another area where contacts are who may not be positive, but they need to isolate. So, and we're going to continue to refine it and grow it as the need demands.
Will that be enforced, though? Like, will they be forced to stay there? I guess that's my question.
I will have to get back. I know we are looking at security. So I think it won't be, the first place that we're looking at will be for people who are compliant and could self-isolate at home, but for whatever reason, someone in their home, a little person or a chronically ill person, makes it a higher risk situation. But if there are people who have different social needs or they're not complying with the public health orders, that would be a different route, and it would be a strategy that we will have in place to manage. So
Okay, thank you.
there will be security.
Up next, Global, Derek.
Hey, Dr. Roussin, I'm just wondering, out of the 194 cases, if you look at other jurisdictions in Canada and the States, are you surprised that the number 10 hospital, does that surprise you that only 10 are hospitalized?
No, right now the numbers are still as they're growing certainly, but they're relatively low to be using as a denominator for calculating these type of rates. So we know that the vast majority of people do have mild symptoms with this infection, but that low and somewhat predictable number will be hospitalized, will require intensive care, and then unfortunately we do see deaths related with the virus. So these rates right now are in keeping with much of the rates we've been seeing in Canada.
Okay, thank you, Derek.
Thank you.
Moving to CBC Radio Canada, Laisa.
Actually, my question is about, let's say in grocery store now we have like the plastic barrier to protect cashier. But when we take example for hospital like St. Boniface, like receptionists, right now they don't have that barrier. Is it something that you're thinking about?
Putting up the barrier, so I mean, this is added protection. Again, this virus is spread through direct, close, and a prolonged contact. So if you have that 2-meter separation, then you don't really require a barrier. And then with talking about like food and things like this is the importance of a lot of hand washing is important. But to have that barrier is added protection. But really, if you can maintain that 2-meter separation, you're dramatically decreasing any risk of acquiring this virus.
And I would also say our guidelines that have just recently been posted about universal PPE will also provide a barrier for those people working at St. Boniface.
Okay, moving to the Brandon Sun, Bud Robertson.
Yes, Bud Robertson, Representative Sun. I'm curious to know, of the confirmed cases, are any of those in personal care homes, long-term care facilities in Prairie Mountain? Do you have a breakdown of those?
Of personal care homes in Prairie Mountain? No, I'm not aware of any case of in a personal care home in Prairie Mountain Health.
Okay. And I just want to ask also, the isolation centers, have any been confirmed for Brandon yet, and when will they be?
There is a plan to expand to Brandon, and once we have to do a little bit of a trial here with this first site, and then we'll be looking to expand there as well. So I can give you an update as planning progresses.
Yeah, thank you very much.
Thank you, Bud. And now to CTV, Jeremy.
Hi there, Jeremy Sharp from CTV Winnipeg. My first question is relating to a case or a possible death. The Louis Riel School Division has released a statement on its website talking about someone employed by the Louis Riel School Division who works at Windsor Park Collegiate who has passed away. Are you able to confirm that this is related to COVID-19, and is this the second death that we have heard about in the province?
Well, I can't speak to details about an individual. What I can say that the second death that we unfortunately had to report was not at their place of employment during the infectious period.
Okay, thank you. And my other question, the CDC, I'm sure you guys have seen, has started to recommend people wear masks during this COVID-19 pandemic. I understand that your directive in the past has been not to wear masks. What's your response to that, hearing that the CBC is now recommending that?
Yeah, it doesn't really change a lot of my previous statement. What I would say is that the best way to protect yourself against this virus is to stay home. If you must leave, then adhere to strict social distancing strategies at all times. Wash your hands at all times. Keep that 2-meter separation. If someone wanted to wear a mask, then perhaps some benefit to it by protecting you from touching your face. It certainly isn't going to be a certified mask, so we can't know if it does have that benefit. But what I do know is that it should not change your actions in any way. If you were going to stay home, you should continue to stay home. Don't wear a mask to think that you can now go out. If you were going to go out and you're going to maintain very good social separation, continue to do so with or without a mask. So wearing these masks should not change your behavior. Your best step right now is to stay home. And then I would add to that if we're talking about actual surgical masks or procedure masks, then those are much better utilized in the hands of healthcare workers. And so that's my thoughts on that.
All right. Thank you, Jeremy. Now we go to the Free Press. Kevin Rollison.
I hope you can hear me fine.
Yeah.
But say, maybe I misheard it at the beginning, but are you going to stop reporting the numbers coming in on a daily basis, just go to weekly, or?
Yeah, I was going to just go to weekly. Unless you have a burning question, I can answer them as you ask them.
Yep, so that'd be all of the numbers, whether it's deaths, positive cases, we'll get it once a week?
No. Yeah, I think you were just speaking about the health links numbers?
Yeah. So we'll continue daily to give you reports on the positive cases and the lab tests, but just in terms of health links and the lab reporting of negative results and the access center visits, we'll make those weekly now.
And bearing in mind Dr. Roussin's comments about stay at home, etc., that the City of Winnipeg has now announced they're closing down the entire Skywalk system, including the concourse. Is that something from your expertise needs to be done now, or?
Well, I think it's just another continued step to that everyone's taking to really escalate that message that this is not business as usual. This is stay home. And that's the best advice right there. If we stay home, everyone stays home as much as they can, we're going to dramatically interrupt the transmission of this virus. If you have to go out, then ensure physical distancing, ensure washing your hands frequently. But all these steps, and we see a lot of Manitobans stepping up, these are all just to increasingly enhance that messaging that now is not the time to be outside. Now is the time to be at home for the most part, physical distancing at all times.
Thank you, Kevin. Now we go to the Selkirk Journal and Brooke.
Hi, it's Brent Jones with the Selkirk Journal. Dr. Roussin, Ms. Siragusa. I received a message at the newspaper on April 3rd regarding a concern. The person who sent the news tip alleges that there is an assisted living facility in the province. I can't speculate where, but perhaps in the Interlake, that is still providing congregate meals. Are all care homes and assisted living facilities supposed to suspend all congregate meals throughout the province? And if so, how is this policy being adhered to?
Yeah, I think the messaging is clear that these groups of 10 is a real number. We've had this messaging out for quite some time. And we would continue to escalate that messaging that now is not the time for large group settings. And so every place in Manitoba, including these places, should really be working away from those type of group settings. And so if there's any that are operating that way, I would encourage them they could contact public health for further advice. But definitely now is not the time for group meals, definitely not the time for group settings. It is the time for physical distancing, and especially for those who are at increased risk of complications of this virus.
Thank you. Follow-up is related to food. As an example, so often we attend functions where food is being served. Tongs will be set up for people to use in order to pick up sandwiches, vegetables, and dainties. However, with this practice, each person handles the same set of tongs. You see new recommendations and changes to food handling practices and to be implemented when we move beyond COVID-19 and go back to gathering at large functions.
Right. So certainly right now this should not be an issue right now, right? Because people really shouldn't be out at large functions with shared meals. Now is the time we should be at home. But this is frequent hand washing is our best bet with this, and having alcohol-based hand sanitizer present if possible. But all of these type of establishments are regularly monitored by public health inspectors and reviewed on their food handling practices. But certainly right now, this isn't the time for a sort of a congregate meal type thing with this. But going forward, this is what's really important with that frequent hand washing and staying home when you're sick. Translates into a lot of situations.
Okay, thank you.
Thank you, Brooke. Now, Canadian Press, Rob Drinkwater.
Yes, for the N95 gently used masks that you say that you're going to begin collecting, what sort of process are they going to go through? What do you do with them?
Well, there is a sterilization. There's different processes you could use, but the one that we're going to use is a sterilization process where it basically cooks all the germs out of the mask, and it has been reviewed with staff health and infection prevention and control. So it is a study going on. So we're going to continue that study and make sure that those are safe for our staff. But our understanding is that once it goes to the medical device reprocessing and goes through that sterilization process, then they can be used quite a few times, like up to 10 times potentially, but we'll have to make sure that with every sterilization that they maintain their integrity.
So you won't be reusing those until the study is done? Or will you begin reusing them right away?
Dr. Kumar is leading this study, so he's already done some evaluation, and I think it will be ongoing as we go, so it'll happen in real time. So after each batch of masks would be sterilized, and then they would be checked, and then they would be distributed if safe to go.
So this is going ahead now. The masks will begin to be reused now, is what I'm asking.
I'm not sure if the masks have been sent out for redistribution, but the sterilizing part has started, yes.
And will they go to frontline workers right away once they're done?
If they are deemed suitable for use, yes.
All right, thank you. That completes our first round. We'll have time now for one more round of questions, but this is just one question, no follow-up this time, please. Starting again now, Winnipeg Sun, Josh.
Just looking at the new cases and wondering how many are community transmission, and if we know any from previous days that can add on to the 6 that had been previously announced.
Yeah, so these 12 that are announced today, I don't have any further reports other than just the numbers at this point. The public health investigations were started last evening, and so we'll hear more. And I'm not aware of any more reports of community transmission since the last report.
Thank you. Holly.
Hi, Holly Carrick with CBC. Just wondering for a little bit more information on the isolation centers. Like, will we be told where they are, what they are they hotels, what's the capacity kind of thing? Could you just elaborate?
I will elaborate as we have more details. So we just need to get our processes and our staff in place, and then we can share more information about how you get involved and how you get referred, and what the process is to enter the building safely, and where you would go. So more information to follow on that.
All right, and global, Derek. Okay, CBC Radio-Canada, Melissa.
My question would be about this center that you are announcing. Are you considering to have like a French service in those centers for people that may need to have some resources in French?
Mm-hmm. That's a really good question. And if we don't, we will. I'll make sure.
Brandon Sun, what?
No follow-up from me, thank you.
CTV, Jeremy.
Just a quick follow-up in relation to masks. We've heard from a lot of people who are making masks at home. I know some companies have volunteered to kind of rejig their manufacturing plants to be able to make them, but also people at home that are sewing their own masks, doing that kind of thing. Do you have any advice for people that are doing that? Any comments on that?
Yeah, same. Similar to what I mentioned is that if you're making your own masks, they're not going to be certified, so we don't even know if they're effective or not. So I certainly wouldn't rely on them. Possible benefits are. There's a possibility of a benefit. There's a possibility that it may prevent you from touching your face as much. But really, it shouldn't give you that false sense of security that you can change your current activities. My message is to stay home. And if you can't stay home, then to adhere to physical distancing strategies at all times, with or without a mask. If you preferred to wear one of these masks, don't let that make you feel safe to loosen up on your physical distancing strategies. Don't make that allow you to feel safer that you can leave your house more frequently. That's certainly not the message. So message is stay home. If you're concerned about the virus, which you all should be, stay home. If you have to go out for necessities, physical distancing at all times. If you felt like wearing a mask, don't let that change your behavior.
Thank you.
Winnipeg Free Press, Kevin Olson.
I guess another quick question about the isolation center, that if I'm John or Jane Doe out there and I believe that I should be in there, is the process set up? Would a person go through health links? Do they have to go through a doctor? Will there be a special number they call?
Yeah, so right now we've been going through occupational health and public health. So when they identify a positive either worker or patient or contacts, if there's a high-risk situation, they would be referred. So I think for now that's the process we're going to follow, but I think as the numbers continue to grow, we're going to have to evolve our process, and I suspect there will be either a number or a website, an email where people can identify. But there is screening criteria so that we need to know if you're a healthcare worker or if you can't isolate or if you're a contact, what is the context of the situation, so that we certainly want to help people out, and we believe these isolation centers are a key component to maintaining the spread of the virus.
And for the staffing there, will you have like full-fledged nursing staff there, or is it more of a caregiving model of just healthcare workers maybe? Or
yeah, so as we start off, we're going to start with a small staff and then build gradually. So most of the people who are going to come in are able to self-isolate fairly independently, but we know there's going to be people who need help sometimes going to the bathroom or just need something. So we will make sure that there are people available. For the most part, it would be a home care attendant as well. Public health will continue to be in contact and do their surveillance, their daily surveillance with these people. So there'll be support around. There won't be tons of support, and it is not. It's not meant to be a medical hospital. So if something happens with these people who are in isolation where their condition changes and they need to go to a hospital, they will go to a hospital.
Okay, thank you. Selkirk Journal, Brooke.
Thank you, Glenn. Hi, it's Brooke Jones with the Selkirk Journal. Yesterday, during a conference call with the Interlake Regional Health Authority, the concept term, the power hour, came up where health facilities put extra enthusiasm, extra time cleaning more often. Just a comment in regards to this concept sort of going through the health facilities throughout the province.
Have you heard of this?
I've heard of it,
Okay.
yeah. Have you heard of it?
No.
So I've heard of it. I like the power hour. I think it's a great idea, and I actually I have heard about it in Interlake Eastern, and I think that's something that we should promote everywhere. That's a great idea.
Superheroes. Good. Well, thank you.
Okay. Canadian Press, Rob Drinkwater.
Yeah, sorry, I actually don't have the name of the speaker other than Dr. Roussin. What's your name, and could you spell it, please?
It's Lanette Siragusa, Lanette, and my last name is Siragusa.
What are you?
I'm a nurse. I'm the Chief Nursing Officer with Shared Health.
Chief Nursing Officer with who, sorry?
Shared Health.
Okay, thanks.
You're welcome.
And we have time to throw it open for a couple of last-minute open questions. Again, please identify yourself and who you're asking the questions to before we wrap things up.
I do have another question. That's Holly Carrick, CBC.
Sure. Hi, Holly.
Hi. Yeah, I'm just wondering if there's any update on the status of the 2 Winnipeg personal care homes that had COVID cases, and how many more may have been tested, or are there more people testing positive there?
Right. So the one PCH there, that the care home that had a worker that was tested positive, Action Marguerite. I'm aware of a worker that had tested positive. 3 other workers have been assessed and tested negative, and there are currently no other clients that are symptomatic, and so they're taking the precautions that are needed, but there's no further cases to report there. If there another care home there's no further updates.
Okay, thank you.
Josh Aldridge, Winnipeg Sun. Just a quick question about using hotels as to expand that into isolation and other services. I know that's put the request for proposals out there earlier this week. Do you know how many hotels came back with proposals, and how this could expand across the province?
No, I don't have that information, Josh, but I know there also was an RFP that was going out, I think from Families and Justice, also looking at isolation spaces for different populations. So it's going to be an ongoing thing, and I don't know what the numbers were, and we can see if we can find out for you.
Thank you.
Thanks.
Hi, Brooke Jones with the Selkirk Journal. There's still talk about testing everyone in the entire province, a population of more than 1.3 million, and right now we're only testing those with symptoms. Obviously, that would be an exuberant cost and take a long time to test everyone. Just sort of a follow-up in regards to regarding this concept, just to.
Right. So testing is certainly one aspect of our response, but it is only one aspect. Testing alone will not manage COVID-19. And so there's really very little benefit, if any, to testing people without symptoms. So it's very unlikely we'll ever be at a point where we're testing people who don't have symptoms of respiratory illness. So we've expanded our testing. So we certainly include anyone who's had recent travel and symptoms, healthcare workers with symptoms, those in conjugate settings with symptoms, First Nation communities, anyone who's had symptoms, of course people who have been contacts to cases or suspected cases. So we've expanded that, and as time goes on we'll continue to expand if necessary. But those basic concepts of staying home when you're ill can also, play a bigger role than even testing. Somebody who stays home when they're ill with mild symptoms, with or without a test, they're not going to transmit that virus, whatever virus they have. And so that's really that message. So if you can, stay home. Certainly if you're sick, stay home. Hand washing, all the physical distancing, and then testing. We'll do it at the appropriate time and place. But that testing is only one component. We have to focus on the whole strategy.
That makes sense. Thank you, Dr. Roussin.
Any other questions before we wrap things up?
Yes, I have another question. It's Holly at CBC. Just wondering if there's any plan to provide more info on those that are in hospital, like their ages or what communities they're being hospitalized in.
Yeah, I think that's something that we're going to try to work up for everyone, and maybe provide a weekly update on some of those type of demographics of the more severe cases, hospitalized and ICU. So we're going to try to find a way to keep that up to date and supply that information.
Thank you.
All right. Thank you very much, everyone. That concludes our conference for the day. We'll talk to you again tomorrow.
Thank you.
Thank you.